Abortion, a word that sparks debates, ignites passion, and touches hearts. But beyond the headlines and rhetoric, there are stories of girls, families, and choices filled with complexity, nuance, and humanity. In Ghana, unsafe abortion is a silent killer, claiming lives and shattering families.
I had no idea I was pregnant during that time, so my sister told me that I was pregnant. I denied, and it came with a lot of complications. I had balls in my hair. I was feeling very dizzy, very like a whole lot. I couldn't eat. I couldn't stand on my feet. I couldn't do anything for myself. So I was just there one time, and my mom brought me a medicine. Then she asked me to take it, that I'll be okay. And me being very naive by then, at that time, I also took the medicine. And then she kept monitoring me every now and then. So I became very suspicious, and then I asked her what the reason was. And then she was like, don't worry, you'll be okay, but you start seeing some spots. She said it in her language, that don't be afraid. So that was what got me, that was what caught my attention, that no, there's something wrong somewhere.
It is a leading cause of maternal death, responsible for over 9% of fatalities.
The time the blood started flowing, it was very smooth. It came out very perfect. But 2 days, 3 days time, I started having pains under my abdomen. So she was like, don't worry. It's because it works like how your menses flow. And me, normally, I don't have much pains when I'm having my menses. And it keeps happening, And I also keep complaining. The guy responsible, let me say my in-law, also used to bring me Lipton early in the morning with a lot of sugar. And then she would tell me I should take in the Lipton. It will melt the blood for it to flow well. But I keep on having those pain, which I keep on complaining to them. It took me about 3 weeks before I started feeling okay. Even with that, I myself had to rush to the pharmacy to get myself some medications because the pains were unbearable.
They have these choco bombs, grinding bottles, a whole lot of concoctions. And also when they have the information that maybe this person, somebody's talking about a medicine or a concoction, and the person mentions that this one, when you are pregnant, you can't take it. Then it's telling the person, or it's giving the information that when you are pregnant and you take it, it can abort.
This documentary goes beyond the controversy to expose the risk, stigma, and silence surrounding reproductive health care. We shine light on the brave steps being taken towards safer, more compassionate solutions to empower women and girls.
So the Empower Her project was started last year. And the goal is to empower young people, especially the young girls and young women, so that they would be empowered to take decisions in terms of their reproductive health. So the focus is just mainly to empower young women so they take rightful decisions.
The Family Health Division, that's Ghana Health Service, has pioneered effort to be able to roll out the comprehensive abortion care program across all regions in the country. And this, what we mean is to create an enabling environment where women will be able to receive safe abortion without suffering harm, right? And to do this, a lot of structures have been put in place, starting with addressing most of the hurdles in the way for women or factors that contribute to mortality or death and harm for women and girls. Here we start with issues around governance, there are barriers at the level of leadership in many facilities within the country, and here there are a lot of strategies aimed at addressing this aspect of it. We also have the health workers issues to do with the training skills of healthcare providers, and there are strategies to address that. Another major problem is stigma in society. So there is a huge advocacy component that is addressing how to do what we call values clarification and address all issues around stigma to create an environment where women and girls can receive safe services that will preserve their life.
As a provider of CAC service, public perception, so many public perception that you are doing bad, you are doing evil, but of course, our values has been clarified, and once it has to do with provision of service and you are trying to help the young person not to opt for the unsafe means for the service provider, our values have been clarified. So the issue of stigma is not really a problem for PPAG staffs, but for the young people, we go in with certain activities that would also help them to clarify their values about perceptions, myth about the procedure. So for the young people that we really have contact with, we don't really have those issues with them. And also we provide them with psychological and emotional support after the procedure.
Right, that's in essence the embodiment of what we call the comprehensive abortion care, where clients that go into the facilities receive a package of services that include the appropriate counseling. We have some we call option counseling and so on, where they make a decision whether they want to keep the pregnancy or not, and they are helped through that process. At the end of it, it's not every woman who says want to end her pregnancy that really wants to do that. At times, after you take them through counseling, a lot of them might decide that they will rather keep the pregnancy, and they'll be supported through that process to probably get some assistance in caring for the baby or offering the baby for adoption and things like that.
After my first abortion, I had a second one, and with that one, I had a little information, or I've learned a little about reproductive health. So I was bold enough to go to the facility, talk to a nurse. I was referred to a doctor, and then yes, they educate me before, or let me say they counseled me on, and then they asked me the reasons of me wanting to have an abortion, and then I gave them my reasons. Yes, and then they did it for me. It was very easy for me.
The long-term risk of unsafe abortion is that some might end up with infertility. Some might end up losing their wombs. They have reoccurring abortions. And some, at the end of the day, you will see that they have an incompetent either cervix or the womb that cannot hold pregnancy to term.
Over the years, I think the single most important hurdle has been the issue of stigma. And here we are all familiar with situations where people will point fingers, and that this doesn't happen only to people in society, or to put it in a better way, it includes even health workers, right? So once a lady or a girl gets into a facility with any problem of such nature, there are situations where people might want to judge based on their own religious or social beliefs, and might even redirect them out of the facilities. And we are saying this shouldn't happen. We should encourage people to come so that experts will have a talk with them, they will counsel them appropriately, and so that they can make the right decision for themselves and be supported through that continuum, so that at the end of it, they do not suffer any harm.
Health, as defined by WHO, is a complete state of physical, mental, and social well-being. So once somebody is pregnant, a young person is pregnant, and then he's unhealthy, you need to go to the hospital to seek help. Once the young person is carrying a pregnancy and says that psychologically I'm not sound to take the pregnancy to term and would require that I would get to the hospital for service, there is the need for the service provider to provide service for the client, because at that particular moment the young person is sick, and where do you expect a sick person to go? It needs to be get to the hospital.
So talking about unsafe abortion, we're saying that all abortion processes that are not done in the environment that is conducive. I'm talking about the hygienic conditions, also the skill of the person providing the service, or both, will make it a bit dangerous to the client. And we're saying that shouldn't be patronized, especially in this time and age that we have a vibrant, comprehensive abortion care policy that provides all that the client needs, including psychological support and all that. We're encouraging women and girls who, for any reason, think that they won't want to continue their pregnancy. At least they should have the opportunity to meet an expert that will take them through the process, provide them the appropriate counseling, so that the decision process will be guided, and at the end, the right intervention will take place.
The pre-counseling that we give for abortion service includes the family planning service, so that by the time the person goes through the services, she would have made an informed decision to opt for any family planning service of her choice, so that we make sure that before the person leaves, she's going out with all the services that she will need to continue, the medications and everything, and then the family planning services as well. We also give information about cervical cancer screening as well, so that the person can come back for that service if everything is fine with the person. And we insist on, especially with the use of the condoms, because the condom is the only family planning method that has dual protection. It prevents pregnancy and at the same time prevents STIs.
So we need to treat abortion as a public health issue, because teenage pregnancy is on the high, unsafe abortion is still there, and once we don't take care of these things, mortality will still go up. So we need to look at how we can address, because once a young person or the young woman is not ready to carry a pregnancy to term, they are ready to go all out to do anything, and it ends up bad if they are not given the right care. So I think as a country, we need to look at that, so that the issue about maternal mortality, the issue about unsafe abortion could be addressed.